Margaret Chan, we talk about economic reforms in China, but none of that is going to be sustainable unless we have health reforms, fit and happy people to create and produce. In your new report, you say that better quality healthcare is achievable at lower cost and for many more people. What's the first step?
Well, health and wealth has an undivided relationship, and we learn from ample evidence. Bad health, you do not have the capability to learn in school or to do your best and realize your potential. So we would encourage governments to provide universal health access to affordable care. And this is exactly what the Chinese government is moving in the right direction.
You're championing a people-centered, integrated approach. Amazingly, though, for some people, you want to keep people out of hospitals. How's that going to work?
Hospital services is important, but it has to be linked in a seamless manner with well-trained GP, people-centered service in the community. We call this a tier delivery system because, small illness like a cold, you don't need to go to the hospital. And what I'm seeing in some big tertiary hospitals in China is far too many people crowd to hospitals for, cold or cough and simple illness. Much of those can be dealt with by well-trained general practitioner in a community clinic. And this is exactly, what China needs to address in the next step of their healthcare reform.
Let's talk now about smoking, because as a health champion, as a doctor, you always have spoken about smoking. It's unbelievable that today about 1 million people die in China every year of a tobacco-related illness. And to put that into perspective, that's well over 2,700 people every 24 hours.
Right.
It's a big war that you're waging. You've taken it to state leaders this week, including to President Xi Jinping. If you could ask him to do one thing for you in the war against smoking, what would it be?
Well, the one thing I would recommend to the Chinese government for their consideration is to have a strong national tobacco law to ensure that all public space are smoke-free. Because people, we call it, secondhand smoking is killing more women, children, and men. And these are people that do not smoke, but they are influenced by smokers who are sitting next to them or, dining in the same restaurants. So it is important for the government to address tobacco control.
The president speaks so often about the Chinese dream. I want to ask you what your Chinese dream is, not only because your 10 years at WHO is drawing to an end, but also just you as a person, you as a woman. What's your dream?
My dream as a Chinese, of course, now I'm the Director General of the World Health Organization. I do not wear my nationality on my sleeves. In 12 months' time, I'm coming home. I retire from my second mandate in the World Health Organization. I like to live in a community, and I like a well-trained general practitioner to take care of my health and help me to navigate, to use the hospital services if required. And far too many people now are crowding to hospital, even for a common cold, and that is not necessary, and that's not good for health.